New COVID-19 testing rules for land travelers will come into effect tomorrow. Canadians crossing the border from the U.S. for non-essential reasons will have to now show proof of a negative test, like you do when you're getting off the airplane. And a week from now, there'll be even tougher new measures for air travelers that will kick into place, including quarantine in a government-approved hotel. Lots of people have a lot of questions about this, so we'll try and put some of them this Sunday to the Public Safety Minister Bill Blair. Nice to see you, Minister.
Good morning, Rosemary.
I'll start with the change that's happening overnight at the land border. I know that 90% of the traffic right now is quote unquote essential workers, truckers, people bringing us things that we need to survive. So this doesn't apply to them. But are you going to look at potentially using rapid testing for those essential workers at the land border?
Yeah, I'll tell you, we're working very closely with the Public Health Agency of Canada and also with our provincial health authorities to looking at implementing a system of regular testing to help protect those essential workers and truck drivers that are coming into the country, and also to ensure that they're not the source of any new infection. And so that's separate and apart from the measures that we're implementing with respect to non-essential travel. But we want to make sure we protect those individuals and protect Canadians from that essential activity. You know, we've had food on our shelves and we're getting products to market. And, you know, that's vitally important for Canadians and for our economy, but we want to make sure it can be done safely.
Okay, well, that's good to know. I'm going to move now to the issue around hotels and getting tested when you arrive back on a plane into Canada. Does the ability to grant people exemptions lie with the Canadian Border Services? How does that work?
Well, what we do by order in council is we provide very clear direction to our border service officers on what the requirements are and how to define essential travel. That information, of course, is also available to Canadians so they can understand what to expect. And so there's a certain amount of discretion that is applied, but we also recognize, Rosie, that in all circumstances, there are compelling and compassionate cases that present, and we, in those cases, take the advice of the Public Health Agency of Canada, and we try to deal with those compelling cases in an appropriate way.
I'm sure you've heard lots of examples. I'm going to give you another one just because I'm speaking to a woman later in the show who goes down to LA once a month for clinical trials to treat her cancer. She has young children. She doesn't know, she has no exemption right now. She still has to quarantine when she goes home, but she certainly doesn't want to pay $2,000 and stay in a hotel for 3 days. And so far, she hasn't been given any information from anyone about whether this would apply to her. In a general way, does that sound to you like something that would require or merit an exemption?
Yeah, Rosie, I'm not unfamiliar with the circumstances of that case. It's been brought to my attention by the local member of Parliament, and so we're in consultation with the Public Health Agency of Canada and with the BC Health Authority to make sure that situation, and it is a compelling situation, yes. and we want to make sure that woman can receive her treatment and put in measures that can protect her family, and protect her community, but also deal with the exceptional circumstances that woman is experiencing in an appropriate way, and so. We'll rely on the advice of the Public Health Agency of Canada on how that transit, her need to transit back and forth across the border can be dealt with appropriately.
Okay, that's good to know. Your government's also expected to announce some kind of exemption for Olympic athletes so they don't have to pay for their hotels. Could you expand that to other Canadians who are also maybe don't have the money to put themselves into a hotel? And why is that such a high price anyway?
Well, first of all, I think what's important is we recognize, we looked at the experience in other jurisdictions as well that have used compulsory stays in hotels during a portion of the quarantine, particularly while we have these individuals tested. And as you know, the Public Health Agency is in requiring people who are now entering the country to take another molecular test. Yeah. And the purpose of the sequestering and the isolation in those hotels is to await the results of those tests. What we have seen with a number of different cohorts of travelers is the Public Health Agency and the local health authorities have been able to work out very robust, rigorous health assurance plans for certain individuals. We've done it for other sporting activities, for example, that can be worked out. Rosemary, the bottom line for us is quite straightforward. We're very concerned about these variants, and we've seen now in Newfoundland, even in Prince Edward Island, the first emergence of a variant has been reported today. Those variants, I think, represent a very, very significant risk. We want to make sure that we do everything possible at our borders to slow down the importation of that virus, while our regional public health agencies and provincial agencies right across the country are working tirelessly to get the situation under control and contained within Canada. We're doing our very best to make sure that we secure the border in such a way as to slow that virus down, the variants down.
I get that, but what if someone's coming back and they don't have that money? They can't pay it. What happens to them?
Well, quite honestly, I think there will be ways in which we will find to manage those individuals. But quite frankly, what we are urging Canadians to do right now is not travel. Yeah. If the purpose of your travel is not essential, and I think that's been fairly clearly defined, and if instead it's discretionary, if people are choosing either to vacation or return from vacation at this time, now is not the time. And what we would ask Canadians to do is stay where you are, shelter in place, and not to be moving about, because the movement of people is one of the ways in which this variant is being spread. And so we're urging Canadians not to travel unless it's absolutely essential. And if there are compelling circumstances, we're prepared to deal with those in an appropriate way. But generally, I think Canadians have to understand these rules are put in place for their protection, but also for the protection of the nation. And so they're harsh and difficult, but they're necessary. And then we're asking people to avoid travel if they can, and if they must, we're going to do what's necessary to protect Canadians.
So if you have a compelling situation, if you believe that you have a good reason to travel, that it is necessary to you, what do you advise Canadians to do? How do they go about trying to make sure that they will be able to avoid that quarantine on the way back?
Well, first of all, they shouldn't try to avoid the quarantine. The quarantine is our most effective measure to protect Canadians.
Well, the hotel quarantine, I guess, is what I mean. Yeah.
Well, the rules are being put in place to ensure the safety of all Canadians, and so I don't want people just sort of looking around how they can get out of it. But if there are compelling circumstances, like the one you referred to at the outset of this conversation, with a woman who has to travel down there for clearly compelling medical reasons, then those circumstances, I think, can be addressed by the public health agency, and consultation with the public health agencies that my border officers can receive guidance and advice that will enable us to deal with that appropriately. For the majority of Canadians, if you don't need to travel, don't. And if you need information, it's available to you on our website, which is Canada.ca, or as well, they can reach out to their local member of parliament, or even to my office, or to the Public Health Agency of Canada to seek guidance.
Okay, you're going to get a lot of emails after that.
You know what? Listen, we're getting a lot of emails. Yes. Naturally, people. I know that there's a lot of Canadians who, for example, have been down south at their winter residence, the so-called snowbirds, and a lot of them are planning on coming back towards the end of March or early April, and I know this is concerning to them. Yes. But we are strongly suggesting if they don't need to travel at this time, don't. Okay. And when they do return, we want them to give them lots of advance notice. First of all, make sure you get the test.
Yes,
Make sure if you're going to arrive at the border, have a test, because there's real consequences for not having it. Okay. And there are some pretty strict conditions we're putting in place.
I got to go. Thank you so much, Bill Blair, on this Sunday morning. Appreciate it very much. Bill Blair, Public Safety Minister here in Canada.